Hey all, welcome back to the Real Life Pharmacology Podcast. I am your host, pharmacist Eric Christensen. Thank you so much for listening today. Today I'm going to cover those test prep pearls as well as things that happen out in practice for the SNRIs. Before we get into that, reminder, go to reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. Great study guide, great refresher, whether you're out in practice or whether you're preparing for board exams. So go take advantage of that. Simply an email will get you access to that. Again, do that at reallifepharmacology.com. All right, so just a little bit of background. SNRIs, that stands for Serotonin-norepinephrine reuptake inhibitor. Essentially, they increase serotonin and norepinephrine in the central nervous system. There's going to be, obviously quite a few overlapping adverse effects to SSRIs because these drugs increase serotonin. But on the flip side, we've got some norepinephrine effects as well. And you'll kind of see how that plays out as I get into the agents specifically. I would say from a general standpoint, where you're more likely to see these medications used compared to the SSRIs. First and foremost, if there's coexisting pain syndromes, fibromyalgia, neuropathy, for example, in association with depression and anxiety, or kind of a comorbid condition there with depression or anxiety. Also, having that norepinephrine effect, these may be a little bit more stimulating for some patients. So if somebody really struggles with a ton of fatigue, maybe an SNRI is a little bit better choice than some of the SSRIs. All right, the list of drugs, venlafaxine, Effexor, desvenlafaxine, Pristiq, duloxetine, brand name Cymbalta, levomilnacipran is Fetzima, and milnacipran is Savella. So I'm going to talk about these agents individually, kind of highlight a couple of things that really differentiate themselves maybe from the class as a whole. So first one, I believe venlafaxine is the oldest, generic, relatively inexpensive, so that's an advantage. Brand name Effexor. More commonly, you will see Effexor XR, so that's the extended release formulation, or venlafaxine extended release. The norepinephrine aspect of this medication is pretty tied to the dosing of the medication. So at lower dosages, we're going to have basically, kind of more serotonergic action. And as we escalate dosages, then we maybe get to more norepinephrine effects. And historically, it's thought that the pain-relieving effects are more from the norepinephrine increase. So in general, with venlafaxine, to get some of that pain benefit, for most patients, you got to go up on the dose a little bit there. All right, big downside with venlafaxine is it does have a pretty short half-life. So I believe I've talked numerous times about serotonin discontinuation syndrome, or SSRI discontinuation syndrome. Patients taking venlafaxine, if they don't have it for a couple days, for example, they can start to experience those discontinuation syndrome symptoms fairly quickly. The XR formulation, as far as tolerability, may be a little bit better than the immediate release formulation. Again, those common usages, depression, generalized anxiety disorder. Potentially you may see it for like panic disorder. I really don't see it very often used for pain syndromes. Occasionally you might see it, but duloxetine is the one that's probably used more often there. Adverse effects, some GI upset, nausea. Occasionally you may see some sweating, insomnia, and then sexual impairment is a really important one to remember. Just like SSRIs, SNRIs can cause this adverse effect. So in general, switching from, let's say, sertraline to venlafaxine due to sexual dysfunction from sertraline, you're probably not going to get much more benefit going to venlafaxine. It's probably going to cause that issue as well. All right, and then the last thing I really want to mention with venlafaxine is that norepinephrine effect. As we escalate dosages, you may be more and more likely to see hypertension, so high blood pressure. So that's an important thing to monitor as we escalate dosages of venlafaxine, okay? So really, really important monitoring parameter there. And then, of course, pay attention to those withdrawal symptoms. If patients are missing doses, skipping doses, don't have their med for a period of time for some reason, or we potentially inappropriately discontinue the medication where we don't taper off. So really, really important for somebody that's been on it for a while, months, years, you're going to want to taper off that medication. All right, I'm going to stick with the essentially the cousin, if you will, of desvenlafaxine, Pristiq. So it's got it right in the name, very similar. Basically, it's a more targeted, more specific. It's the active metabolite of venlafaxine. Dosing's a little bit more straightforward with desvenlafaxine versus venlafaxine. Maybe a few less drug interactions and CYP enzyme involvement, so that's kind of an important thing to pay attention to. Usually only once daily dosing, so a little bit more simplistic. The major indication here with this medication is depression. That's what I've seen it used for. But we're going to have a very similar adverse effect profile. Some GI upset, some increases in blood pressure, potentially sweating. So again, very, very similar adverse effect profile to venlafaxine, which you could probably anticipate there. So, big things here, maybe a few less drug interactions. The cost of this medication is generally going to be quite a bit more than venlafaxine, which is why I typically don't see it utilized. You'll often hear it reported as a little bit cleaner version of venlafaxine. But again, the cost historically has been a little bit of a barrier. And then, clinician comfort as well. Not many clinicians know a great deal about it. So I think that's probably one of the big reasons, too, why I don't see it utilized that much. All right, let's take a quick break from our sponsor, and we'll wrap up with the other SNRIs. If you're in the market for any pharmacist board certification study material, we've helped thousands of pharmacists pass their board exams and can absolutely help you too. BCPS, ambulatory care, NAPLEX, BCMTMS, geriatrics, lots of different board exam information. Go check that out at meded101.com/store. I'm greatly appreciative of all your purchases there. They go directly to help support this podcast. In addition, if you're a nurse, I've got a new course out, Nursing Pharmacology Review course. Absolutely 16, 20 hours of content, good content, real-world stuff that you're going to see out there and that you're very likely to be tested on in school as well. So that link will be under the nursing tab. We've got stuff for med students, pharmacy technicians, plenty of content available there. Again, all your purchases there go directly to help fund this podcast, and I greatly appreciate it. All right, duloxetine, brand name is Cymbalta. This medication I primarily see used for that pain indication. We can have peripheral neuropathy, we can have fibromyalgia, we can have chronic musculoskeletal pain as all potential uses of this medication. That's in addition to depression and generalized anxiety disorder. So most common situation I see this used for is, clearly patients probably got anxiety, they probably got depression, and we have that pain component of some sort mixed into the condition of the patient. And, there again, we're trying to kill two birds with one stone. Adverse effect profile, pretty similar to venlafaxine. Definitely see a little GI upset occasionally. Maybe a little bit more dry mouth with this medication. That might be on account of kind of the norepinephrine effects there. So those are really the main ones there. And then obviously any type of serotonergic effects as well can happen. It does have that mechanism there. So, increasing the risk of serotonin syndrome and things of that nature. Monitoring parameters, Typically, don't worry about too much. Obviously, we want to see a response, whether we're treating depression or pain or those type of things. Blood pressure, something to keep tabs on. Again, the norepinephrine effect of this medication could increase that a little bit. Not something I see crazy bad. I mean, I usually don't see dose, increases of, 10 or 20 or more in that blood pressure, the systolic blood pressure. But again, something to pay attention to. If you've got a patient that's needing multiple medications to lower blood pressure in SNRI, it might be something you want to look at. Maybe reassess, make sure we're at the minimum effective dose. Could we decrease that dose and potentially help with that blood pressure a little bit as well? So primarily, great option that you're going to see utilized when we've got the mood and pain syndromes involved there. That's where I see it the most. Rarely, I have seen it used for stress incontinence. That's an off-label use, but I have seen that a couple of times in practice. So I wanted to point that out there as well. All right, next medication is levomilnacipran, brand name Fetzima. This tends to have a little bit more norepinephrine activity compared to the serotonin type activity. Primary indication is depression, but being a little bit more norepinephrine side of things, it may be a little bit more activating than some of the other agents, and certainly more than the SSRIs. The norepinephrine piece of it also can bring in elevations in heart rate and blood pressure and things like that too. So that's going to be an important thing to pay attention to. Otherwise, adverse effect profile, pretty similar to some of the other agents. Maybe a tish more insomnia with this medication. So paying attention to that, heart rate, blood pressure, all important things when using this medication. All right, then the last one I want to cover is milnacipran, brand name Savella. This is actually FDA approved for fibromyalgia. It's not FDA approved for depression. Pretty balanced as far as the serotonin and norepinephrine activity. But again, with the studies of this medication, we have that benefit shown for fibromyalgia treatment. Similar adverse effect profile, some stomach upset, constipation, potentially insomnia, and maybe a little bit of tachycardia or increased blood pressure. Again, probably going to be dose dependent, maybe a factor depending upon other comorbidities and other medications as well, where maybe there's an additive effect there. So good thing to pay attention to is those cardiovascular risks with the SNRIs. Not high risk, but definitely something to be aware of. I would say, again, with that indication of fibromyalgia, if you're going to see this medication, that's probably what you're going to see it for. We've got tons of other options for depression and tons of studies and evidence for other medications in depression. So you're probably not going to see this medication used off-label for psychiatric purposes like depression or anxiety. It is costly and expensive, at least at this time. So that is one of the things, probably one of the primary things that limits its use, other than maybe a lack of familiarity, compared to duloxetine, which is generic and much cheaper in general than milnacipran. That fatigue, so it can definitely help with that, and in fibromyalgia, that can be a big concern, is fatigue, and so milnacipran could be showing some benefit there in those situations. All right, well, that's going to wrap up the podcast for today on SNRIs. I hope you picked up a few practice pearls. If you enjoyed this episode, do me a huge favor. Leave a rating, review on iTunes or wherever you're listening. I greatly appreciate that. If you've got any comments, questions, feel free to reach out. mededucation101@gmail.com. And, of course, support the sponsor, meded101.com/store. We've got crossword puzzle books, pharmacy technician books, case study books for med students and clinicians, nursing pharmacology review course, and, of course, pharmacist board exam study materials as well. So, again, thousands of purchases over the course of over a decade now. I think we've helped a lot of people learn pharmacology, get a great product, and also obviously help support me and this podcast. So greatly appreciate that. All those links, purchases can be done through meded101.com/store. All right, I'm going to sign off for today. Thank you so much for listening. Take care. Have a great rest of your day.